Hello, welcome to another time of Health and Wellness with Olajumoke. Today we'll be talking about a very interesting topic which I believe one or two of us may have experienced before, either as a child, growing adult, or even in our older adults. We'll be talking about furuncle. What is furuncle? Furuncle is the medical terminology for boil. So boil is a skin infection that involves ear follicle and surrounding tissue. It usually starts as a tender, painful nodule. It can be red or purple in color based on your skin, and it gradually fills up with pus as it progresses. So what causes boil? It is believed that there is a particular bacterium called Staphylococcus aureus that is responsible for boil. It usually penetrates into the skin when there is an open area or a cut on the skin. So when this happens, it can lead to furuncle. Now there is another one that is called carbuncle. Carbuncle is simply clusters of boil that are connected in a particular area of the skin. So when there is more than one boil in a particular location that comes together, that is called carbuncle. So furuncle, carbuncle. Most time we would see boil in our faces, the back of our neck, thigh, armpit, buttocks, and what have you. Any area that has ear follicle where you can easily sweat or can easily experience friction. These are areas where we see boil. How can we manage this? There are home remedies that can help to treat furuncle. I would advise, because it is painful, use over-the-counter medication. Your ibuprofen, your Tylenol, your paracetamol. You can take those every 6 to 8 hours to help with the symptoms. But aside the symptoms, what can we do? It is advised to put warm compress. You can easily just get a towel, soak in hot or warm water, and put it over the area where you have the boil, and change that every now and often. It helps relieve pain and can help the pus to come out quicker. If you are like me, back at home, we do use one thing we call shea butter. So you will just take some shea butter, rub it over it. We believe it helps soften it and helps the pus to come out early. Don't prick your boil. I know we often prick a lot. Avoid pricking or squeezing out the pus. We feel like it makes us feel better, but there is a danger of spreading this infection to other surfaces when you squeeze it out or you prick it. So don't prick, don't squeeze. Leave it. When it's ripe, the pus will come out and you'll feel relief. Another thing that is important when you have a boil is to maintain proper hygiene. Spread out through bacterium. So if you share towel with someone who has a boil, you may end up having one. So it is very important to maintain proper hygiene. You clean, you wash with soap and water, especially when the pus are coming out. Wipe, wash with soap and water. That's another thing you can do when you have a boil. Now, there are times when boil can become severe, especially when it comes with fever, or it's getting bigger, or everything you have tried in the last over a week is not working. I would encourage you to speak to your physician. When it comes to medical intervention, what are the things that they do? It may be incision and drainage with local anesthesia, but it is advisable that only a physician should drain your boil. Another way to treat boil is through the use of antibiotic. So they can give antibiotic to help kill the bacteria and then make you feel better. And that thing I know they often use also is steroid injection. You know, steroid, what does steroid do? It reduces inflammatory reaction, so that can help improve your health. I hope with these few things today you would have learned one or two things about boil. about Furuncle, about carbuncle. If you have any question relating to this, please feel free to put in the comment section, and I would appreciate if you can share with me today what sounds new to you, what you learned from today's session. Otherwise, till we meet again on Health and Wellness with Olajumoke, I want to tell you to stay positive and stay healthy. Bye for now.